Have you ever been told that your headaches, jaw pain, or facial pain are just something you have to live with? Or maybe you've been told it's just stress, or maybe your dentist had told you to wear a night guard or try to relax, but your symptoms just keep coming back? The truth is, TMJ problems are often much more complicated than just clenching your teeth. Hi, I'm Dr. Brian Orcutt, and I started up Orcutt Family Dentistry back in 2006. And one of my favorite things to focus on in our office is helping patients who suffer from TMJ disorders, jaw pain, headaches, and facial pain. The TMJ, or temporomandibular joint, is the joint that connects the lower jaw to your skull. It's one of the most complex joints in your body. And when it isn't functioning properly, it can really create a lot of pain and symptoms that many people don't even realize are due to TMJ. There's actually over 40 TMJ-related symptoms. Some of the more common ones are jaw pain, clicking or popping joints, headaches or migraines, facial pain, neck pain and tension, ear pressure, ringing in the ears, and sometimes muffled hearing, cold sensitivity of the teeth, and teeth that are wearing down and breaking. Many people spend years treating the symptoms of TMJ without ever finding out why they are actually having the pain in the first place. They treat the symptoms with Botox, acupuncture, massage, a chiropractor, and physical therapy. While these techniques help in the short term, frequently the pain comes back because the cause is not addressed in the first place. That's where our approach is different than most dental offices. We actually measure and gather data which helps us determine where the source of the problem lies. Once we know what the problem is, then we can develop an individualized treatment plan for every patient. Every patient is different, and there is no single treatment that works for everyone. Some patients may benefit from bite therapy, some from an orthotic, which is like a specialized night guard, and some may need a different approach depending on what we find. Our goal is to understand how the jaw joints, muscles, and teeth are all working together. When we meet a TMJ or facial pain patient for the first time, we start with a comprehensive evaluation that includes advanced 3D X-ray imaging of the jaw joints, 3D mapping of the teeth, muscle testing with bio-EMG technology, and a computerized bite analysis with a T-scan and an evaluation of the joint itself with JVA, or joint vibration analysis. These tools allow us to see things we simply cannot see during a traditional dental exam or by looking in the mouth. One of the most common problems we find is that the teeth, muscles, and jaw joints are not working together in harmony. Certain teeth need to be touching each other in a very precise manner to give patients the best opportunity to reduce the chance of TMJ and facial pain. When your bite is not balanced and the teeth don't touch each other properly, certain jaw muscles contract like a reflex over and over, causing the jaw muscles to become fatigued and painful. And just like any other muscle in your body that you work out way too much, it hurts. In the case of TMJ though, this is a muscle reflex that causes the muscles to contract. You can't control this reflex. And if you don't fix the bite, then it will continue forever. Over time, the extra stress this puts on the muscles can lead to pain, tension, headaches, and damage your teeth, bones, and gums. There are different ways you can treat TMJ. You can treat the symptoms using Botox, orthotics, massage, etc. Or you can treat the problem at its source so that it's likely to diminish the symptoms altogether. There's nothing wrong with Botox other than it doesn't last long. Botox is a great short-term solution for chronic facial pain, but it only lasts a couple of months before you have to have a follow-up treatment. We believe the best way to treat most TMJ cases is by using a technique called DTR, or disclusion time reduction. With DTR, we precisely measure how your teeth come together and how your muscles function, allowing us to make extremely small adjustments to the teeth in order to reduce the unnecessary muscle activity and create a more comfortable bite. Once the teeth touch properly, we can significantly reduce the muscular contractions that cause all the facial pain, jaw pain, and headaches that cause TMJ. And a side effect of DTR is that once your teeth touch properly, This will immediately reduce your risk for tooth fracture, bone and gum recession, gum disease, cold sensitivity, and tooth loss. Some patients may not be candidates for DTR due to the way their jaws are aligned. For these patients, we can only make orthotics. These orthotics look like a night guard, but are specially made and custom fit and balanced for each individual person. The most important step is getting the right diagnosis and determining what is causing the TMJ or facial pain in the first place. If you've been dealing with jaw pain, headaches, facial pain, or you feel like nobody has been able to explain what's going on, we'd love to help you look deeper. Schedule a TMJ consultation with our office and let's find out what your jaw is trying to tell you. I look forward to helping you smile, chew, and live more comfortably and confidently.